Hi again, Penny Wheeler here. Fortunate enough, as I said, to be president and CEO of Allina Health. And we're trying something different, as I mentioned last week, in terms of turning to a video format to communicate with you. Communications is such an important part of what we do. So we're trying this different forum to highlight issues that are facing our communities, going on at Allina Health, or actually some of the challenges that we're facing as well. No greater challenge maybe that is present today than one we're going to talk and discuss with Dr. Roger LaRoche today. What we want to talk about today is actually the challenge of the opioid crisis that we're facing and what we as an organization are doing about it and what can be done to support those people who are suffering in more profound ways. I heard Dr. LaRoche is becoming such a crisis that recently I heard that 91 people a day in this country are dying of an opioid overdose.
It's incredible, really. The United States is about 5% of the world population, but consumes about 90% of the world opiate supply. So it has affected our country unlike any other, and it is really, as they say, an opioid epidemic. Some of the statistics show that about 10% of high school seniors have tried opiates just in the past month, 10%. Wow. 4% of adults have abused opiates in the past year. We are talking about our families, our loved ones.
Can you talk a little bit about some of the things we're doing and some of the impact we've had? Long way to go, but we've had some impact already through some of your leadership and that of your teams.
The inpatient unit is now certified to be an official MICD, that means mental illness chemical dependence. And that's unique. You know, so many programs function just as a addiction medicine unit, a rehab unit. This is going to focus on both. It is the first in the area to do so. It is our goal to kind of use the size of Allina and hopefully create an absolute center of excellence for addiction medicine here at Allina.
I also understand that we're doing things in terms of prescribing differently and being able to dispose of drugs differently and being able to have antidotes to overdose available. Can you speak to any of those efforts at all?
Sure. Well, you know, there's probably 4 times more number of opiate prescriptions available now that are prescribed than there was just 10, 15 years ago. There has to be some attention to how to reverse a potentially toxic reaction. That's where the naloxone comes in, that the government is trying to allow individuals to have, care providers to have to use right away, and families to have if they have family members that are afflicted with this opiate problem.
I understand too our prescribing patterns have changed so that in our organization 1 million fewer opioid pills are on the market because of changes that we've made in our prescriptions, but there's much more to be done.
Absolutely, much more to be done. And one of the things that we could do, we were just starting to apply for certification institutionally to be a Suboxone provider. And our hope is by the middle of the summer, we'll be doing that.
Anything else you'd add or anything you'd want to make sure that people knew in the organization of what's going on or this crisis in general?
Sure. Well, you know, it's always said knowledge is power. And the more knowledge that's available, the more empowered we are to make changes. This applies for our kids as parents, it applies for our elderly parents. We have to be informed. And so we're trying to encourage everyone to learn all they can, to not be afraid to ask questions, not be afraid to confront, and to by every means contact emergency rooms, helplines which are available, to learn more and to confront this problem before tragically your loved one might become a statistic.
Boy, I cannot thank you enough for what you brought to this organization and how we're trying to address some of the most difficult problems that our community faces as a whole. And to all of you, you know, we'd like to solicit your help as well. It's really important to hear stories of people who have been affected by this crisis, and actually you all have different life experiences where you see best practices or ways we can help, you know, either prevent something from occurring in the first place and or helping others who are suffering. So please, your stories are really impactful, as are your insights through life experiences of what additionally we might do as a community to help. Don't hesitate to send them. You know my email address, penny.wheeler@allina.com, similar to all of yours. Thank you so much for watching and take good care. Thank you for what you do for all we serve, all whom we serve every day. Thank you.